Hi everyone, I'm Priya Mistry, the TMJ doc, and today I'm going to talk to you about TMJ relief from the comfort of your own home. What can you do from the comfort of your own home to help relieve TMJ symptoms? One exercise that helps reduce the pops and the clicks within the jaw joint is called the 6x6 exercise. For the 6x6 exercise, you want to start with your teeth edge to edge as if you're biting off a thread. This position can be kind of hard to tell just by feel if you're in the right position, so standing in front of a mirror to actually verify that your teeth are edge to edge is a good idea. Once you get to that edge to edge position, you want to open wide and then go back to that edge to edge position 6 times a day. That's why it's called the 6x6. It's easy to remember. Definitely don't do it 7, 8, 9 times a day. You can overdo it and irritate the joint. And remember to keep your teeth edge to edge. That's a very vital part of this exercise. Another thing to keep in mind is that this exercise does not work quickly. It can take several months or even years to help reduce or eliminate jaw joint noises with this method. First and foremost, you can do muscle releases or myofascial release on yourself from the comfort of your own home. Myofascial release, this technique, involves applying sustained pressure to tissue in order to increase range of motion and to eliminate or decrease pain. Let's start with the lateral pterygoid. This is a muscle that I call the troublemaker because it can refer pain to the head, to the jaw, into the ear, behind the eye, and even to specific teeth. The lateral pterygoid muscle is also a key player in clenching and bruxing activity. To release this muscle on the left side, you'll use your right pinky and vice versa. So you take your pinky, again, you twist your hand so that the nail is facing towards the teeth once you're inside the mouth and the pad is towards your cheek. And then I'm just gonna go as far back and up as I can. You'll see that I'll open wide to begin with, and then I'll close about halfway to increase access way back there. So here we go. I hit the shot. Change the angle. Okay. Once you've applied pressure in one spot for 10 to 15 seconds, change the angle of your pinky and go for it again. So you can do this changing the angle 2 or 3 times. And I wouldn't recommend doing this lateral pterygoid release more than 1 to 2 times per day. And that's really it. Let's move on to releasing the masseter muscle. The masseter is the largest and most powerful chewing muscle. To release this muscle effectively, there's one technique that we do from outside the mouth, and then there's one that we do inside the mouth. Basically, what you do is you just take your middle knuckles, which are these guys, and you place them right underneath your cheekbones. And then you run your fingers with inward pressure all the way down to the angle of the mandible. Use as much pressure as you can handle. This muscle is big. It's often overworked, especially if you're watching this video, you're watching it for a reason. So you can do this one multiple times a day, 3 or 4 times each time you do it. And it really helps to relieve any tense or fibrotic areas that build up in the masseter muscle. If you don't want to use your fingers, you can also use this handy dandy jade roller. This jade roller is great because it does the exact same thing. You can apply pressure inwards as you support the other side of your head and then go all the way down to the angle of the mandible. Now let's go inside the mouth to release the masseter by running perpendicular to the fibers of this muscle. For this release, you'll need your pointer finger and your thumb finger, same hand, same side. So take your pointer finger and go as far back inside as you can. So run along your inner cheek till you hit bone. Once you hit bone, then use your thumb to grab the outside and give it a little pinch. Once you've got a good grasp on that deep masseter, then sustaining that pinch, come slowly forward. Then you go back in and you grab everything a little bit lower at a different level. Give it a little pinch and come all the way forward. And you can do that as many times as you need to, as long as you run the entire length of the masseter, which goes from the cheekbone all the way to the angle of the jaw right here. So let me put my glove on and demonstrate that. So basically, you're going to take your pointer finger and your thumb back. Feels good. So again, the masseter release, the outside and the inside one, you can do multiple times a day, more than I would recommend doing the lateral pterygoid release. The next muscle we're going to release is the temporalis muscle, which is a large fan-shaped muscle and is a key player in clenching and bruxing activity, just like the masseter and the lateral pterygoid. To release this muscle, you can use your middle knuckles, you can use your fingertips, or you can use that jade roller. So basically what you're going to do is take your fingertips and start right at the base of that muscle where it starts and go all the way up and back with pressure inwards. And you can do that a few times. It feels really good. And another way to release just the anterior or forward fibers of this muscle is to find the little indentation behind your orbital bone and your cheekbone. So kind of feel your cheekbone, feel your orbital bone, and go just right behind. And same thing on the other side. And just apply inward pressure for 10 to 15 seconds at a time. This is where many of us hold a lot of stress and tension. And this is typically where tension headaches are or begin. So releasing that temporalis muscle can help quite a bit with those tension headaches. For more relief, be sure to kick bad habits. No gum chewing, no pencil or pen chewing. Don't rest your hand against your jaw when you're awake or when you're sleeping, and try to limit your caffeine intake. Try to limit it to 1 to 2 cups of coffee per day or 1 to 2 cups of tea per day. Lastly, if you're having a TMJD flare-up, avoid tough or chewy foods. You can never have TMI about TMJ. Thank you.